Hi everyone, today we're going to be talking about listening to the lungs, and I have a lot of different stuff in this video that's not just pertaining to listening. I have some anatomy and some different terms describing lung sounds. So let's get started. So first I want to start off with some anatomy. These are obviously your lungs, and I want you to make sure that you take into account that this is your left lung and this is your right lung, so it's switched from what you might think it might be. And in our lungs, there are different lobes. So that's the main thing that I wanted to go over. So our left lung only has two lobes. The first lobe is the superior lobe, right here. And then this is our inferior lobe. And then this right here we call the cardiac notch because your heart fits right into there. So once again, the left lung has two lobes, the superior lobe and the inferior lobe. And then it has this little notch called the cardiac notch. Our right lung has three lobes. It has the same superior lobe, it adds a middle lobe, and then it has an inferior lobe. So once again, the right lung has three lobes: superior, middle, and inferior. And I wanted to show you guys too, kind of real time, what these lobes might look like on an x-ray. They're pretty hard to see, but I found a great image that has them color-coded. So this is our left lung, and we know because it has two lobes, superior, inferior. And then this is our right lung, which we know because it has three lobes, superior, middle, and inferior. And I'm going to talk about this later, but the anterior or the front view really doesn't show a lot of the lower lobes. So when we're listening to the lungs, when we listen to the front of the chest, we're mainly listening to the superior and middle lobe. But when we listen to the back and posterior, we're really listening to these lower lobes. So I'll talk about that later, but I just wanted to throw it in now. Okay, so here are some terms describing our breathing. So our normal range of breathing is 12 to 20 breaths per minute. So if somebody is having eupnea, this is just normal breathing. They're not having any difficulty, it's unlabored. And then bradypnea is anything slower than 12. So 10 breaths per minute, 9 breaths per minute. That would be a bradypneic patient. Tachypnea is fast breathing, so anything above 20, so 42 breaths per minute, 35 breaths per minute, that would be a tachypneic patient. Dyspnea is difficulty breathing, so are they using accessory muscles when they're breathing? Do they show pain when they're breathing? That would be dyspnea. And apnea is absent breathing, so the best example I have for that is sleep apnea, when you wake up snoring because you stopped breathing for a second. So these are terms describing breathing that you might see in a patient's chart or that a nurse or doctor might describe to you. And so these are some lung sound terms that I wanted to talk about. Overall, lung tissue, the sound is resonant, so make sure you really try to memorize that. And then we have three other sounds that I'm going to briefly talk about. We have bronchial, bronchiovesicular, and vesicular. So I have this nice little chart here that labels them all out for you. So for bronchial sounds, you hear it over the trachea. It has a high pitch, and the expiration is longer than inspiration. For bronchiovesicular, you hear it over the major bronchi and the first and second intercostal spaces anteriorly and between the scapulae. It has a moderate pitch, and expiration is equal to inspiration. And I just want to add, intercostal spaces are just the spaces in between your ribs. Vesicular is just heard over normal lung tissue. It has a low pitch, and the expiration is shorter than inspiration. So adventitious sounds are abnormal sounds. So if you see written on a chart adventitious, just know that means it's not a normal sound that's happening. So those are things like wheezing, rhonchi, crackles, or you might hear them called rails, and friction rubs. Alright, so now let's get into where do you listen for the lungs. So if you're just doing an lung assessment, where are you going to listen? So the best way to listen is to do it in a ladder format, and I'm going to show you how to do that. But first, when you're listening to the anterior side, like I said earlier, you're going to be listening to more upper lobe sounds. So anterior is the front of the body, so make sure you know that too. So when we do this, we're going to start right up here, right above the clavicle. You're going to go over here, and then compare it to the other side. And then you're going to jump down into the second intercostal space, listen here, and then you're going to go over here and compare it. And then you're going to go down into about the third intercostal space, and then jump over. So as you can see, I'm making a ladder. You always listen on one side and then compare it to the other. You go down and compare it. And then you're around about the fourth intercostal space, and you compare it, and you go down and compare it, and then you go over here. There's a little one over here that this view really doesn't show you it too well, but if you were to take a profile view, it would kind of be tucked in underneath the armpit a little bit, but a little bit lower. You can kind of see it more over here than over here. So from here you would jump over here and then compare it to the other side. Then go over here and compare it, and then down here and compare it. So I want to make sure I draw out for you the ladder just so you can see it. So you start here, go here, then compare, go here, down. You're always comparing to the other side when you listen. Then you go over here. So that is how you listen to the anterior portion of the lungs. So for the posterior portion, like I said earlier, these are more lower lobe sounds. As we saw in that x-ray from the anterior view, we really don't see a lot of the lower lobe, so we have to make sure that we are listening to that too. So for posterior, same aspect of listening like a ladder. You always listen to one side and then compare the other. So you'll start over here, right around the shoulder blade, like above it a little bit, and then you'll compare. And then you go down, compare, down. Same exact pattern as the front. So once again, just for you visual learners, I'm just going to draw the ladder aspect again. So here. All right, and that is where you listen to the posterior side of the lungs. All right, everybody, that was it. Hopefully this video helped you out a little bit. Don't forget to like and subscribe. All right, see you guys.